Kenya has been ranked third globally for cases of medicalized FGM by the United Nations Children's Fund, UNICEF. The high ranking has jolted the country not only because the practices persist, but because it is increasingly being carried out by trained healthcare professionals. The very people entrusted to protect women's health are now performing a procedure they know can be dangerous, traumatic and life-altering. And as Mary Mwoki tells us in the following report, East African lawmakers are pushing for a powerful regional law dubbed Elimination of FGM Bill 2025 in order to close the loopholes that allow both medicalized and cross-border FGM to thrive.
Has been dubbed as betrayal in scrubs. Doctors, nurses and midwives, often regarded as guardians of health, have now become major drivers of FGM, often sought by families who perceive it as a safer alternative with fewer immediate health risks and a faster healing process while still adhering to cultural expectations. The bill explicitly criminalizes healthcare providers who perform or facilitate FGM, imposing heavy fines of up to 4.5 million on offending hospitals.
The advocacy that took place before concentrated on the harms of FGM. So you're seeing people trying to mitigate that harm by opting to go to medical practitioners or using medical equipment such as anesthesia, or even going to institutions to go through FGM.
This medicalized menace cuts across Africa. A UNICEF report from 25 countries found that rates of FGM medicalization among women aged 15 to 49 are highest in 5 countries, Kenya included. Sudan leads the list of shame with 67%, followed by Egypt with 38%, with Kenya and Guinea at 15%, followed by Nigeria at 13%. The Ma community, which has embraced the cut for generations and ostracized the uncut, has signed a declaration to unanimously abolish the vice. Ma cultural chief Daniel Koitoi Kipilosh says the declaration from 33 Ma-speaking communities will end the vice.
When an uncut girl gives birth to a child, that child is given a name. And this name is associated to bad omens in the society. So we bless the mother, which in this case a mother who is not cut, and we also bless a child, so that they all become equal, like any other child.
The EAC Elimination of FGM Bill 2025 seeks to forge one unbreakable legal shield across the 8 East Africa member states. The bill criminalizes cross-border FGM practices and will close legal and enforcement loopholes that exist between national laws, such as those related to cross-border and medicalized FGM.
We have a lot of issues in cross-border. We have a lot of issues of our girls going to our neighbors. We also have porous borders. So the regional bill is going to give us a coordinated effort so that we implement the law together.
Mary Mwoki, Citizen TV.